Okay.
Hi, my name is Troy Miller, and I'm a pharmacy student from Albany College of Pharmacy, and today I'm going to be talking to you about prevention and recognition of drug diversion. So there's a few objectives we have for this presentation, and the first one is to be able to describe common signs of drug diversion, assess how drug diversion affects individuals throughout the healthcare system, and also to recount Porter Medical Center's current policies and procedures. So to start, we should start with actually defining what drug diversion is. And the Center for Medicaid and Medicaid Services define drug diversion as diversion of illicit drugs for an illicit purpose. And the National Association of Drug Diversion Investigators describe it as any criminal act or deviation that removes a prescription drug from its intended path from the manufacturer to the patient. So it's basically drugs that have prescription drugs that are diverted for use but not as directed by a prescriber to you. So next we're going to talk a little about the statistics behind it. The statistics are hard to come by because this is often not reported or underreported. So the DEA, the Drug Enforcement Agency, estimates that it's about a $25 billion a year industry, but this does include all aspects of drug diversion, not just hospital drug diversion. So between 2001 and 2003, the DEA reports that over 130,000 methadone 10 and over 63,000 OxyContin tablets were diverted by employees of pharmacies and healthcare systems. And then finally, a study by Trinkoff and colleagues estimates that 7% of nurses abuse prescription medications, and this is actually probably a low estimate, as in the study it was a self-reported study that was in a mail-in flyer, so basically we're just going off who wanted to tell people that they were abusing prescription drugs, so this more than likely may be higher. So what should we be looking for? And for the next few things, this is going to encompass what generally you see. This may not involve every person, may not fit these descriptions, and just because people may fit some of these characteristics doesn't mean they're diverting drugs. And just remember that it's everyone's responsibility to monitor for drug diversion. So the common medications that are diverted are opiates, tranquilizers, sedatives, amphetamines, and inhalants. So things like your narcotics, oxycodone, your stimulants like Ritalin and Adderall. So some common signs of drug diversion are work absenteeism, people just not showing up to work, people that somehow always, you can't seem to find them, they're not where they are supposed to be. A lot of times they spend too much time near the medication supply, so you'll find them a lot of times in the med room or where medications are being held. Sometimes they're unreliable, they have trouble keeping appointments and meeting deadlines. Their productivity can alternate between really high and really low. Sometimes they're your best employee and sometimes they're a little bit under your best. They have sometimes some confusion, memory loss, some concentration issues. There may be some interpersonal issues with their peers. They may have frequent wasting of medications. Somebody, for some reason, their person always seems to need dropping their medication or something. They always need you to help waste medication. Sloppy record keeping can also be something that you can notice. Their notes just aren't as clear as they used to be. There may be inappropriate prescriptions for large amount of narcotic doses. Sometimes there's range doses, and for some reason their patients always seem to be at the upper echelon of the range scale. They maybe always want to inject their patients by themselves. You notice, oh, you're busy, I can go help you, but they insist that they have to do it. They may see deterioration of hygiene, appearance, how well they note in the chart, their handwriting. There also may be some inappropriate wearing of clothing. During the summer when it's really hot outside, you may see them wear long sleeves. You may notice personality changes, and then again, just may have issues with their patients and their peers. So who does diversion actually harm? Is it just the diverter, or is it more people throughout the healthcare system? So obviously the first one is diverter. And they could be at an increased risk for morbidity and mortality. This could be due to overdoses or possible bloodborne infections. There may be criminal prosecution, not for only diverting the drugs, but perhaps substandard patient care. And there could be actions taken against their license as a result. Coworkers can also be harmed in this process. They could be stuck with contaminated needles. Sometimes if they're using while at work, they may not have time to dispose of a needle properly and leave it laying around behind something, and you reach to grab something if it falls and maybe get a needle stick. There could be breaches in policy and procedure, which then again may come back to you. You may witness a medication wasting that you didn't actually witness. And there's liability due to mutual patient responsibilities. If you're both caring for a patient and something happens to that patient, you could be questioned and be liable too. The main one, again, is the patient as well. Patient's a big responsibility in the healthcare system, and they may receive substandard care, as the person may not be thinking about the patient at all times. They could receive doses that aren't adequate to support their pain if they kind of dilute the dose of their narcotics, so they divert some from themselves and give the patient a small dose. Their pain may not be managed appropriately. And then there's always a risk of transmission of diseases. There is reports of hepatitis C being transmitted in healthcare systems because of drug diversion. Somebody injects themselves and then draws up to dilute the dose and injects the patient. And finally, the employer could be harmed as well. And this can result in loss of revenue. Another big thing is the loss of patient trust. If patients in the community don't trust a healthcare facility, they may choose to go somewhere else, which hurts not only the employer but the rest of the staff, as well as cuts may have to be made. And finally, there may be civil litigation if something does happen to a patient while they're at the hospital. It could be brought against the hospital. So what are some steps that we can take to help make sure that we stop drug diversion? So when you're getting your medications out, make sure you're only taking the current dose for the patient. Don't take the whole patient's dose and keep it in your pocket or at your workstation, because you're going to step away. There may be times where it can be taken. If you're going to be giving medication at a higher, if there's a range scale, make sure you document the patient's pain score or something like that to back up why you're giving this dose at that level. When you are wasting medications, make sure that it is actually witnessed, and follow hospital policies and procedures. They're put in place for a reason, to make sure we're protecting the safety of everybody. If you witness or suspect anybody that's diverting drugs, again, don't be afraid to come to your nurse manager or the director of pharmacy to address the issue, and they can take the necessary steps to ensure that nothing's being inappropriately taken. If you see or hear of attempted access to the medications, report that also to the pharmacy. Even if it's a small thing and there is no drug diversion, it's a bigger issue that may need to be addressed. And don't load badges or passcodes, anything like that. Make sure when you're at the Pyxis station to sign off so nobody can take medications out under your name. Again, we don't want anybody virtually witnessing medication wasting, so make sure if you do vouch for somebody and waste the medication, make sure you do see it. And then finally, if there's a discrepancy, make sure you do report it promptly to the pharmacy so it doesn't escalate as to what may have happened. So now we're going to talk a little bit about the policies and procedures here at Porter. So this is from the Controlled Substance and Distribution Control. All control medications are stored in the Pyxis, in the pharmacy, and the Pyxis out on the units. When you're distributing them, make sure you log in to the Pyxis system under your name, and then make sure you log out at the end of your transaction. So if a control medication is either needs to be wasted, or if it's outdated, damaged, maybe it dropped on the floor, call the pharmacy, and the pharmacist will come out and take that medication from you and log it back into the C2 safe, and then appropriately waste it as necessary. This just leaves a good paper trail for everybody, just so we know what happened. So another big one here is the wasting of the whole and partial doses. Wasting in the medication, hazardous waste, is appropriate. If it is a injectable medication, it can be destructed through squirting down the sink or in the toilet. When you're doing this, make sure you do have a witness. There needs to be another LPN or RN at the time of wasting. And then for the outdated medications to control, for your knowledge, what happens is we log it back into the C2 safe in the pharmacy, and then every 3 to 6 months that medication is wasted by a company that comes in, and there's a DEA 222 form, which is a paper that the pharmacy uses to track medications, and that way there's always a paper trail of what happened to this medication. So again, if they're due to suspect diversion, definitely bring it to the attention of the director of pharmacy right away. They will then investigate, and if there is theft or suspected diversion, they'll fill out a form with the DEA and report it to the DEA, and they will take it to the next level. So the disposal of medication waste, this is again on the policies and procedures. The only one that we're really going to focus on right now is the controlled drug. Again, like before, make sure you're getting somebody to be there with you when you waste. You do need a second person when wasting medication. And then, like I said, the injectables can go into the hazardous waste container, squirted down the sink or toilet. Any whole or partial tablets need to be placed in the hazardous waste so it cannot be retrieved. So this is the policies and procedures for controlled medication discrepancies. This icon right here is the discrepancy indicator on the new Pyxis system. So if this is in the top of the field, that means there is a medication discrepancy, and that does need to be addressed right away. When you do see a medication discrepancy, bring it to the attention of the nurse manager or the pharmacy, and the further investigation needs to be done. If for some reason the discrepancy cannot be resolved, the director of pharmacy will then have everybody stay until this medication is accounted for. And after that, again, any paperwork or anything like that will be taken care of. So this is assistance for employees. Porter Medical Center does have assistance for employees through a company called LifeScope. It's a completely anonymous company, and they can help with many things, not just addiction. They can help with legal issues, relationship issues, grief and loss. This is the 1-800 number as well as the internet login. So it's at lifescopeepa.com with the username Porter Medical Center, and the password is guest. This is again all lowercase. This is a very valuable tool, and remember, it is completely anonymous, so if you do need help, please seek the help that is desired. So, what are the main points from this whole presentation? So drug diversion costs not just the patient, it costs the whole healthcare system. It costs the person diverting the drugs, the patient, which is our main focus, your co-workers, and your employer. Policies and procedures are put in place to ensure that we're protecting not only the patient safety, but your safety as well as an employee and the employer's safety. And again, if assistance is needed, please don't hesitate to use LifeScope. It is a completely anonymous thing. Again, the phone number, email, or the web address is here. And is there any questions?
I have one.
Yes.